This interview is brought to you by NTT Data. Federal health agencies work tirelessly to protect us from health and safety threats that arise at home and abroad, so we work tirelessly to bring them reliable, cutting-edge IT to improve productivity, leverage data, and save lives. As a top 10 IT service provider, NTT Data can help your agency put modern IT solutions into motion with our proven end-to-end practices, platforms, and services. Together, we can streamline government operations, implement AI successfully and responsibly, and improve public trust. Visit nttdata.com. Welcome back to our HIMSS 2025 conference coverage. I'm Sarah Seibert, the Managing Editor of CIO Media and Research. And today I'm joined by Chris Nichols, Program Manager and Chief of Enterprise Intelligence and Data Solutions, or EIDS, with the Program Management Office, Defense Healthcare Management Systems. Thank you so much for joining me today, Chris. I appreciate you taking the time to chat.
Absolutely. Nice to see you.
Yeah, so I just wanted to dive in. What are some of the recent milestones or achievement you've had in your position?
I think let's go back a little bit. So we were asked to stand this program office up about 6.5 years ago, and through that time, the first 3 to 4 years was really about consolidating everything. And so consolidated 24 warehouses together, re-platformed 42 applications into what we call the MHS information platform. But really where we've gotten to with all of that, and that's really with all of the purchase care data and the direct care data. So the MHS Genesis data from the direct care side, but 50 to 60% of the data that we have in military healthcare actually happens out in the community. And a lot of people don't realize that, right? And so, but it's about integrating that together so you can have that holistic view. We kind of finished that up over the last 2 years with replatforming the pharmacy operations capabilities into the platform, and then really around health surveillance. There were 9 disparate capability systems that were doing health surveillance. And we've actually now all have them all inside our platform. And so now we're integrating the back ends. That way, the data can be shared, not just within really the health surveillance space within military health, but the larger biosurveillance space, and with our federal partners from the CDC, HHS, and others. Where I really see that we're at this point in time is we're at this tipping point of going from rationalization, consolidation. Now we have 4.5, almost 5 petabytes of data. We've also, in finalizing this year, shutting down all of our legacy EHRs that MHS Genesis replaced, but then bringing all of that data into the MHS information platform. So you have all of that integrated, right? But now it's really about the so what, because the so what is really what matters. It's been more of a business aspect of things to get to where we are, but it's really now leveraging that data for data science from a data science perspective, natural language processing, machine learning, and really then driving better clinical outcomes, interoperability with our partners like the VA, and then helping this very vast worldwide organization managing the health of the organization. And I say more from the business side, because if you don't have a good business structure to support an organization, it doesn't matter how great the provision of care is, they're not going to persist separately. And so it's bringing those things together.
Right. That's super exciting. And you kind of answered question 2 in your first response by talking about kind of next steps. But as we continue to build out interoperability in these systems, how are you enabling a seamless yet secure information transfer to improve patient care?
That's with partners at the firm. Actually, I was just talking to them earlier today, and it's really about with that team, how we work with the firm and our VA partners for that seamless aspect of multiple components of care. And one of them is the transition of the warfighter from active duty into the VA system. So that view has to be there, that integrated view of the record, but then also from a research perspective, right? There's a lot of longitudinal research that happens between the Department of Defense and the medical side and the non-medical side and the VA. And so how do we integrate that data for those purposes? And then there's interoperability within the DoD as well, that people forget that we are responsible to provide the right data at the right time for the warfighter from a readiness perspective, and that includes with our combatant commands that are all around the world. And then that's that interoperability and that integration of data from a research perspective as well. Well, for operational use, I'll say first, and that's really about how we take data from our systems and integrate that with other data, like we were talking about health surveillance. There's military health surveillance. There's Department of Defense, military medicine health surveillance, and then there's the overlap of health surveillance that happens at the federal sector with Health and Human Services and other departments. And then there's the overlap of that with at the more international level. And so, how do we integrate that data? And then the research community, like I said, I mean, it's how do we integrate from a research perspective all this disparate data to drive better clinical outcomes that military medicine provides, not just to the Department of Defense, but to really the national level as well.
Right, that makes sense. And as you're working to improve health outcomes, how can public-private partnerships be leveraged to accelerate innovation while maintaining some of the data security side of it, as well as regulatory
Sure.
compliance?
Technology is moving at such a pace that we're never going to be able to stay up with technology. And something I said earlier today was we can't get ahead of the curve. We got to know where the curve is at, and we got to try to stay on top of that. And then the conversation I was having, it reminded me that we got to try to surf the top of that crest of that wave as much as possible. Right? And I say that because I don't think in the military health system we have focused on public-private partnerships the way we need to. I think in the research space within military health, there's been a very big focus on public-private partnerships. The vast majority of the research that's done in military health is partnership on the federal side, but with public partners and private partners within universities and others. On the technology side, I think we're an enabler of those things, and I think we've got to get better and better. Part of that is us maturing our technology stacks to be able to have sandbox environments that we can bring partners into. But then it's also looking at industry and not just the core defense industrial base, but the larger on how do we quickly integrate, evaluate, and cut ties if needed or scale. And that's where we've got to get better at. And I think that's a change in our acquisition processes, as well as our managerial processes in the way that we manage health data.
I heard recently that government doesn't have a tech problem; they have an acquisition problem. um,
It's a
so
process problem, right?
yeah,
I would actually frame it more from saying a policy process and human problem, right?
right.
Uh, because it's easy to say that it's this or it's that, but it's really more of a mindset that has to change in order for us to progress, innovate, evaluate, cut off, and move forward and learn from instead of being stagnant in that. And I think so. I think it's less, I would say, less of an acquisition issue. It's more of just a statutory policy and process thing that has to be resolved as well.
Right, that makes sense. And I know AI came up earlier in the interview, but moving forward, what are some of the emerging technologies you're eyeing to improve patient care?
We talk about AI, we talk about ML, we talk about all these buzzwords, and they're buzzwords to me because ultimately it's my focused lanes that we talk about all the time are really getting our data right. And so that's getting standards around the data. There's been a big focus on our part around in that space around the OMOP common data model of healthcare. And so mapping and having consistent ontologies. So the business side understands when we say encounter, here are the 5, 7, 8 different things, and the clinical side they're the same, right? And then there's that component, there's a data quality side, data standards. So it is about getting our data right in that space. But then from a technology perspective, it's really, like I said earlier, figuring out where technology is going, understanding that there are so many products out in the industry that we never can even evaluate all of them because there would be 4 of myself and my chief engineer and all we do is get, tech roadmaps and demos, right? And that's not going to happen. We can't do that. And so part of it is understanding where technology is going and projecting that far enough ahead that then we can really have the right conversations on where do we need to get to based upon the use cases that we're enabling ourselves with as an organization.
Right. It's exciting times, and I'm looking forward to seeing how this all develops, staying on that curve. There's no getting ahead of it. So I appreciate you taking the time to chat with me today. And I look forward to hopefully connecting in the future and we can see what progress has been made.
Absolutely. Thank you